This is our case study on Sophia Lord, and I'll start by describing her diagnoses. So her diagnoses include a right total hip replacement with full weight-bearing status and posterolateral precautions, a right humerus fracture, and signs of early dementia, possible cognitive impairment. Her impaired performance skills include both motor and process skills. Her impaired motor skills are stabilizing, reaching, bending, walking, and enduring, and her impaired process skills include attends, handles, sequences, and gathers. Her impaired performance patterns include her habits, roles, routines, and rituals. Her roles are that of a mother and grandmother. Her routine that has been impaired is her self-care routine, and her impaired rituals include attending church. Sophia's impaired client factors include both body functions and body structures. Her impaired body functions are her mental functioning and neuromusculoskeletal and movement-related functions. Her impaired mental functions include both specific and global mental functions of memory and emotional, and energy, drive, and sleep. Her neuromusculoskeletal and movement-related functions that have been impaired include her joint mobility and joint stability. Her impaired body structures include the structures related to movement and the structures of her nervous system. And lastly, her context and environment includes her social and physical environment. Her social environment is made up of her daughter, who provides assistance and emotional support for her, and her physical environment is her home that she lives in currently that has steps at the front and back of the house, and her bedroom is located on the second floor.
Okay, as we look at Sophia Lord's case, the frame of reference that we chose is the task-oriented approach. And we're going to look at Sophia as she moves through 3 different settings. The first setting that she will be at is an inpatient acute setting. The area of concern that we will be focusing on there is her ADLs. Then she will move on to a subacute rehabilitation setting, in which we will focus on her IADLs. And then finally, her setting will be her own home as she's out in the community, and the area of concern there will be social participation. In the inpatient acute setting, we have a long-term goal, and that is that Sophia will complete self-care ADLs with standby assistance and with the use of a walker upon discharge from acute care. The approach we will use for her, that goal, will be adapt and modify. And the 3 short-term goals under this long-term goal are: number 1, Sophia will safely transfer from sit to stand to toilet with the use of a walker and minimal assistance while following hip precautions for 2 consecutive sessions. Goal number 2, Sophia will brush teeth and wash face with non-affected limb while standing at hospital room sink with standby assistance. And goal number 3, Sophia will perform perineal care upon toileting with non-affected limb while maintaining stability at hospital room commode with standby assistance. The service delivery methods to accomplish these goals are that they will be completed with the OT, possibly with PT participation. They will be in the patient's room every morning, once a day for 30 minutes.
The approach for the subacute rehabilitation setting is establish/restore. A long-term goal for this setting will be that Sophia will safely prepare a simple hot meal on the stove independently within 2 weeks. Short-term goal number 1, Sophia will increase shoulder flexion and abduction active range of motion in her right upper extremity to functional limits in order to reach items necessary for cooking within 2 weeks. The activity will be passive stretching exercises, games requiring active reaching, such as balloon volleyball, reaching balloon targets with lightweight pool noodle. Short goal number 2 will be Sophia will correctly and independently demonstrate sequence of 10 steps necessary to cook spaghetti using recipe cards as visual cue within 5 days. The activity will be sequencing picture cards demonstrating the steps required to cook spaghetti. Short-term goal number 3. Sophia will correctly and independently identify at least 5 safety hazards visible to rehab facility kitchen within 1 week. The activity will be identifying kitchen safety hazards in pictures. Service delivery will be delivered by OT or CODA in the facility, gym, and kitchen in the morning and afternoon, 2 times per day, 45 minutes per session. Okay. The approach for the home setting will be adapt/modify. The long-term goal for this setting will be Sophia will attend at least 3 church-based activities per month. Short-term goal number 1, Sophia will locate public transportation service to enable her to attend church with help of OT within 1 home session. Short-term goal number 2, Sophia will verbally identify at least 3 energy conservation techniques discussed with OT, such as sitting during activities, modifying environment, taking rest breaks, within 2 consecutive treatment sessions in order to reduce fatigue that limits community participation. Short-term goal number 3, Sophia will create a monthly schedule of church-related activities for the upcoming year that she wishes to attend with assistance from OT within 1 treatment session. Service delivery will be delivered by OT in the patient's home on a Saturday so daughter can be present, 1 hour per week.